Joining us now, Dr. Ashish Jha. He's the Dean of Brown University School of Public Health. Dr. Jha, good morning to you. Let's start with the facts.
Good morning, Gayle. Thank you for having me back.
I'm so glad you're here. Let's start again with the facts, because when I hear people say, I didn't take this seriously, I didn't think that this was something that I really needed to be worried about, what more can you say? And I think people are getting very frustrated because they don't want to feel that it's being jammed down their throats. What can we say?
Yeah, Gayle, I completely understand. And I have a lot of sympathy for people who have not gotten vaccinated because they have just been, I do, and I'll tell you why. They have just been fed this nonstop diet of misinformation about these vaccines, that somehow it was rushed, that somehow it's dangerous. And the people who are spreading that misinformation, they usually have an ulterior agenda on all of this. So what we need to do is we need to give people facts, and the facts are these vaccines are exceedingly safe and effective. They work at saving lives, and right now we're only really seeing the unvaccinated get really sick and die from this. If you don't want to get sick and die, there's one way out of this: get vaccinated.
You know, but those of us who have gotten the vaccine, we're thinking it's our superpower, we're protected, but now the unvaccinated people, it seems, are now affecting the vaccinated people. Do we need to revise everything when it comes to masks for both vaccinated and unvaccinated people wearing the mask?
Yeah, it's a really good question, Gayle. I mean, at this point, if you're fully vaccinated, you're really safe from anything serious. You might get a breakthrough infection. You might have a couple of days of not feeling great, but you're not going to end up in the hospital. You're not going to end up dying. That's the most important thing. In terms of mask wearing, it can help for the short run, but in the long run, Gayle, there's only one way out of this. If we want to put the pandemic behind us, a lot more Americans have to get vaccinated.
Yeah, Dr. Fauci said just yesterday on TV that we're heading in the wrong direction. In the spring, you were very optimistic about us heading in the right direction. How are you feeling? I would imagine you're feeling the same.
You know, I am. I was saying in the spring that we were going to have a fabulous summer. Yeah. Through June, it looked really good. I did not expect that we'd have a third of Americans refusing to get vaccinated. I just didn't see that coming. I thought everybody wanted to put the pandemic behind us. Everybody wanted to move on. I figured 95% of people would get vaccinated and we could be done with this thing.
Everybody wants to tippy-toe around, Dr. Jha, ordering that the vaccines be mandatory. Where do you stand on that?
Yeah, you know, it's crazy how we've turned this into a political issue. You know, when I'm in the hospital, I have to have vaccines for the flu and measles. I can't just show up to work without those vaccines. We've got to treat COVID in the same way, and we have managed to somehow politicize this. I think businesses, hospitals, schools have to step up and say, we do this for all these other vaccines. We're going to do it for COVID too.
All right, Dr. Jha, we thank you for your time. Good to see you.